So conjunctivitis is a known comorbidity of AD patients and really regardless of therapy. And the risk factors for conjunctivitis include history of severe atopic dermatitis or really just a past history of conjunctivitis. And in dupilumab trials, conjunctivitis occurred in about 7 to 12% of patients that were treated with dupilumab compared to about 2% on placebo. So when I think about patients who later may present with conjunctivitis, I really think about classifying them into the more mild to moderate versus a bit more severe categories. And I shall say most cases of conjunctivitis that occurred with dupilumab tend to be mild or moderate and can be managed without discontinuation of dupilumab. So for my patients, first of all, what I do is that before I start dupilumab, I have them really just go buy some artificial tears. So as they are starting the therapy, they can actually use artificial tears to make sure that their eyes are lubricated. So sort of a kind of a preventative measure. And if they do experience mild conjunctivitis, again, the use of artificial tears is really important. And I have them buy those single-use twisty tops to just to prevent potential for infection by using ones that may be containing large volume. In addition to that, I also recommend the use of, if they have some mild conjunctivitis, antihistamine eye drops. And some of those may include the over-the-counter antihistamine drops, such as Padaway or Alloway. And if they are more severe, if they have more severe presentations of conjunctivitis, I refer them to ophthalmology immediately. But sometimes there can be a little bit of a wait between when my referral and when they can actually get to see ophthalmology. So if the wait is a bit long, I oftentimes will prescribe a corticosteroid a topical eye drop. And the one that I like is called a fluorometholone or FML eye drop. And the reason is because it has poor penetration really into the anterior chamber of the eye. As a result, it has a lower risk of cataracts or glaucoma compared to other types of eye drops, topical corticosteroid eye drops. And then other options include cyclosporin eye drops, such as things like Restasis that you can prescribe until they see an ophthalmologist, or tacrolimus eye drop or ointment can be super helpful as well.